it on to you
Thank
guys.
you. Thank you so much, Isabel. So I'm Dr. Denkner, pediatric gastroenterologist at Valley and Mount Sinai. I'm thrilled to have my very good friend, Toby Lass-Carpel here to give her insight really on the behavioral piece of toilet training. So I get more of the medical side of these issues, but Toby is really experienced in how to coach through sort of those tricky scenarios and what to do when there's resistance and pushback and failed attempts and older children. So I'm so excited to have her here with me today. So let's get started. And please, again, put your questions or comments in the Q&A and we'll address this at the end. Next slide. So just to let you guys know, we will be talking about some products just because we're talking about potty training. So we have absolutely no relationship with these companies. Next slide. So just to give you a little overview of what we're going to talk about tonight. So we will help prepare you and obviously your kids for toilet training. So we want to help you assess really the readiness of your children for this process. When is a good time? When is not a good time? If there's a new baby coming, if you're moving, things like that, obviously that's not the perfect time for this. We want to review exactly what is needed in your house, how to prep your home, how to prep the bathroom, how to prep your children. What are those kind of special reinforcements that really do work? And then we'll talk about sort of where things can get tricky or where things can go wrong. What do we do when it's not working and how to address any other medical issues. So now I'll pass to Toby.
Thank you, Dr. Dinkner. Hi, everyone. Very excited to be here and very excited to hear that so many people are interested in the topic. So hopefully everyone will walk away with something tangible to be able to help them in their situation. So as Elle Woods in Legally Blonde said, what like it's hard. But clearly we would not all be here if it was so easy. Everyone is very excited to get to the end of the toilet training process and to, be out of the diaper stage. But the process is not always so easy. So, today we're going to break it down into the different steps of toilet training and for different things to look for. And we're going to do, a little bit of problem solving if anybody is here and like maybe has tried to potty train before and didn't quite go so well. To come up with some plan Bs for going forward. So we're going to hop forward, not backwards. We're always going to look ahead. So let's look at what we have to look at before we start, right? So before, even though it might seem like 3 years old, you're going to go to like preschool says that when they come in September, they need to be toilet trained. There's like this magical idea that that's going to happen, but that's not always the way that things happen. So you're going to want to assess on your own whether or not your child is ready for it. And when I say ready for it, like there's a few different ways to look at it. And there are ways to help introduce them to the idea of potty training to make it an easier transition. So some things you're going to look for potty training readiness are, the first is that, do they notice or do they show signs if they're wet? My oldest didn't show any signs that he had that there was anything going on in his diaper. And then my youngest would come up to me with a diaper and say, change me, right? So every kid is definitely different. Like some kids will start to squirm around a little bit more. Some kids with bowel movements will go behind in a corner or crouch by. So just kind of being aware of those verbal or nonverbal cues that your kids might be giving you, like that awareness that there's something going on in their body and like feeling those different sensations is definitely an important cue to be looking for to help your children start to distinguish, that the different sensations that happen around toilet training. The second part is just the supplies, right? So you're going to want to make sure that before you take away, like some kids have, emotional attachments to the diapers, right? And the idea of like giving up the diaper it could be really hard, or they're not going on the changing table, and underwear and all those different things. It's a lot of transitions, right? And I know as a grown up, transitions are really hard. Maybe some of you can relate. And so definitely for kids, right? So as much as possible, you want to try and get those supplies in the house. If you're going to be using a cover for the toilet to make sure your kids don't fall in, right? 'Cause we also don't want to traumatize. We'll get to that in desensitization next. Getting them started on it, having them part of the process, having them pick out. I'm sure that none of this is going to come as a surprise, but pick out underwear with their favorite characters on it, or a toilet seat in their favorite color, or having them involved in what they're going to get when they make on the toilet for their reinforcement. Like these are all things that you're going to want to get and involve them there in the process. The third thing that I want to go on is desensitization. So this is something that it comes up a lot more than you might think. So I wanted to bring it up because, there was some TV show, like I remember like on Nick when I was growing up, and it was like the main character, I was like, Dr. Degner, if you can remember, please jump in. And like the character was scared of being like flushed down the toilet. Like when the toilet flushed, like when they were sitting on it, like there was like a fear going on with that, right? And like it's not crazy, right? You put something in the toilet and then it goes down and it goes away. And if you have a kid who hasn't sat on the toilet, like that concept of it going down could be really scary, right? And then think about when you go, like just thinking about toilet training as a whole and different environments that you might use the bathroom in. If you're out in public and it's a self-flushing toilet, like that's definitely terrifying for a kid that like they could still be sitting on it and then it flushes and all those other things and there's noises. And so all these are definitely things that you want to keep in mind, right? Because like sitting on that toilet, like, I will go into this more in supplies. I happen to really recommend like the toilet insert into the toilet, instead of like the standalone toilet seats. But we'll go into that a little bit more. But you want to make sure that like they're used to like sitting on the toilet, that they feel stable, they don't feel that they're going to fall off or they're going to fall in, and to just like get them used to sitting on it before it's like, okay, like come up, sit on here, like maybe fall in, maybe go down the hole, like and do this all at once, right? Like while losing your diapers. So like these are all just like little things to be like, it doesn't have to be a whole process, but like even those few days before to get them used to the processes, is definitely something that will help the process along. And the last one, and I'm going to touch on it briefly because I'm going to 100% hand this over to Dr. Dankner a little bit later in this conversation, is just medical consultation, like especially if there's any parents here who have tried toilet training in the past and it just wasn't successful, or if there's a history of any sort of constipation or excessive urinary issues or whatever else it is, like getting that feedback from a doctor before starting some sort of toilet training regimen, because you don't want toilet training to not be successful because there's something medically going on that's not going to make them successful. So when in doubt, we always say, like in the behavior community, like always eliminate the medical option first. So so that's just some things to think of before you start. Just to make sure that you go smoothly into the
Maybe,
beginning.
I think before supplies, I don't think we
Yes.
have a slide in here about the readiness. So can you talk about exactly what you would look for in terms of kids' readiness, other than showing that they notice that they're wet or that they want to be changed? Like what else would tell you that they might be ready or might not be ready? Or do you have a certain age? Like some people say, I'm toilet training my 1.5-year-old, which I think is like a little excessive. Do you have any other specific sort of things that you would look for?
I think to me, honestly, what's most important with this, and I say this for children of all different abilities, is like like the ability to communicate is like really important in the process, right? Because when we go through the process of toilet training, you're going to be contriving a lot of situations that you're going to like catch them as they're about to go, as they're about to urinate or defecate, catch them, put them on the toilet, and be like, "Woo, you just went to the bathroom," right? But eventually, at some point in the process, you're going to want to teach them that step of them starting to request, like, "I have to go to the bathroom," right? Because you want to be able to transfer it, so it's not always you prompting and saying like, "Oh, we're going to the bathroom," and taking them on a schedule, and transfer it to them being able to tell you that they have to go to the bathroom. So again, if it could be a one word bathroom, if it's that you take them to take your hand, if they're using a communication device on an iPad, whatever it is, to me, it's more of that ability to communicate, right? Like, and if there's a more of a specialized need, like it's definitely something I'm happy to speak about offline. And I think that for a solid 80% of the cases, like that piece of the readiness, because you might have a 1.5-year-old that is very high skill and could be totally ready, but you could also have a 4-year-old that, that's an appropriate time for them. So I think that's where you have doctors involved. That's where you have, just people that are there that know your situation to help guide you.
Okay, got it. So readiness is for you not an age, but it's more, can you communicate, whether verbal or nonverbal, that you
I
need
think
something?
if we look in general, potty training typically happens within that like year, like
2 to 4.
between the ages of 2 and 3. What?
I said 2 to 4.
Oh, 2 to 4. Yeah, listen, like in between 2 and 4, most threes programs will come in and say like that they want the kids to be toilet trained before that, which is where that like summer rush before like threes programs, you get a whole bunch of parents looking at toilet train like that. So somewhere within that year is what is normed as developmentally appropriate. But a little after, a little before, we all know is every age, every stage.
Okay, perfect. All right, easy enough. All right, sorry. Okay, so next, supplies.
Okay. So just to go into supplies, as I said before, I personally and professionally, I don't like standalone potty seats, and I'll tell you why. The first is that I often find that if you use a standalone potty seat, that you transition to them to that potty like structure, and then once they outgrow it, then you have to transition them onto the toilet, and so it's like you double potty train them. The second reason is because it's for portability, honestly. Because if you get them so used to only going to the bathroom, right, and for the concept of generalization, if they're so used to only using one exemplar of a toilet, right, like what's going to happen when you're out in public or when they're in school or when they're at a friend's house. I happen to really personally, I like ordered 10 of these and had one in every
That one.
bag and in my car because it like folds up super small and had like a bunch of those like sanitary bags that went with it. It wasn't like really pretty. Each kid like put their own stickers on it or whatever. I let them decorate it at the party. But it was definitely like super functional and it got the job done. So like these are also great. Like they all like work with any toilet, like any size. And
Do you
like,
like these latter ones? I do, because they have the step stool, which I'll talk
yeah,
about later. Okay.
I'm totally fine with that. If you have like my kids happen to all get like little benches with their names on it and blocks that we had like half the letters missing from it. So like we just use those as the step stools up and down, but those all look wonderful.
So again, we have no connection to these brands here. I also love that foldable one. So my 3-year-old is quite small and she always feels like she's going to fall into the toilet still. So these are two, the dual training one on the left and then the foldable one on the right that work with small bottoms, and like the foldable one suctions onto anything. So I like that one a lot. The OXO one, the OXO, I keep that one in my car. And like, if we ever need to emergently stop somewhere, if we're on the side of the road, you can actually just pop this open, like with no toilet with you. So I actually like that one too, just to keep in your trunk. But
All right, super mom.
okay, moving on. So these are the products
like,
that I like.
I was like,
We may not agree on all of them.
we haven't gotten there yet, but I think I have to like really thank 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 my good luck for that. But for anyone who hasn't
Oh,
started the process,
we've
that's
used
like a
it
really
many
good shout
times,
out.
many times. Okay.
I'm choosing you for my apocalypse partner.
Mhm.
Um, okay, awesome. So just quickly over here, and I do see that there are questions coming in. We will answer them all at the end. So just, I don't want anybody to think that their questions are being dismissed.
Yes.
Um, again, things just to consider in terms of supplies, Clorox wipes, obviously, because, oh, something to consider just for things before. Dr. Tanker and I both discussed that we are big fans of, for toilet training, putting kids in oversized t-shirts. Um, and like having them toilet train like without pants on, without underwear. And that's for many reasons. One is because like if you're wearing pull-ups or like the training underwear or like anything on your bottom, like when you're toilet training and you have an accident, like you don't feel the accident in the same way because like
Mhm.
you don't feel that dribble down your leg. So it's very hard to get that contrast
Yeah.
between like wet and dry, accident and success. Um, and so like you really want those like very clear contrasts when it's happening. So unfortunately, the first couple of times, like there will be accidents. So Clorox wipes are really great things to have. That being said, like the fun underwear is really great. Again, I don't recommend the really thick underwears that they advertise, like, and I don't recommend like pull-ups for during the day, like at night 100%, but definitely not for during the day. Like thin
Other than
underwear.
naps, I would say, other than just a nap, maybe.
Yeah, again, any sleep situation. I'll make it into a broader definition. Um, any sort of like fun potty book, like there's like the classic everyone poops, P is for potty. Like I'm sure you can get like a whole bunch of them just to again get them used to that idea. And then you're going to want to pick out different things that are reinforcers for them. So like it's we like to stick, we'll talk about it more next, but it's usually going to be something that they can like eat very quickly, or consume very quickly. So like a short video clip or something like that. And
Mhm.
then you're also going to want to give them more to drink when you start toilet training them because you want to give them more liquids because it's going to give them more opportunities to urinate and give them more opportunities like for when they're successful to reinforce and to like practice toilet training. So even so you're going to want to have liquids around that they're going to want to drink. So even if like we never have juice in our house and definitely not soda, but like all bets were off during toilet training week.
Right. This is the
So
time for juice, for lemonade, for ice pops, right? Like whatever your kids can
listen,
drink, not soda.
if you're making them sit on the toilet, at least like bring home a medal for letting them drink juice. So you gotta get your wins somehow during toilet training week.
Uh,
So
this
yeah,
other one with
Lauren.
the dog here, this is like the little wee wee pads for the couch. I never did it. I don't know how
Oh,
much you care about your couch, but some people care more than others. I just kept my kids on the floor.
yeah, I thought you were gonna say that we should all get dogs for toilet training, but I totally get that.
We should.
Emotional support animals for the toilet training process.
We probably should.
Okay, for toilet training. The when you think as a parent, right? Because in all situations in parenting, it's so important to think about like how is like how we set the tone as parents is so important to the process, right? So the things that we're trying to establish in is toilet training is the idea of contingency. So it's I have to go to the bathroom, right? Like I feel the like the sensations that are associated with going to the bathroom. I go to the bathroom. I go to the bathroom in the toilet. I get a really cool snack or I get to watch a video or something that I'm not going to get access to at any other point right now. Woohoo. Or I feel the sensation, gonna hang out here a little bit, not go to the toilet, have an accident, like gonna have to clean this up a little bit, right? So like you're gonna want to start like thinking about things a little bit in that and trying to like give that setting that contrast for the different situations that are going to come up and that like going off of that it's like very important to set the tone, right? Like when Dr. Dinker and I were preparing this, like it's very important that reinforcement is so universally understood as like something positive But
Mhm.
a consequence is not a punishment, right? Like we're not yelling, we're not angry, right? It's what they're like, think about the whole concept of natural consequences. It's like if my toddler knocks over a box of blocks, like what are you going to have them do? Pick up the box of blocks, right? If they spill over a cup of juice, like what are you going to have them do? Like you're going to give them a paper towel and have them wipe it up. Like if they like have an accident and they pee on the floor, what are you going to have them do? Like you're going to give them a big fluffy towel and like help them throw it on the floor and mop it up. Like it's not in a vengeful way. It's more of a like if there's nothing that's going like if you're going to be there and you're going to right away like okay here let me go, let me clean this up for you, right? Like then what's going to stop them from interrupting their play when they feel that next time? Like you're basically acting as the human diaper in that situation because they don't have to do like there's no difference between if they go and they use the toilet or if they don't.
And when you
So
introduced this concept to me, I was so worried that this was seen as like a punishment. But you're saying to do it the same as if a kid is just cleaning up the toys that they knocked over, right? So it's just a
yeah,
flat tone of this is something that you may not want to do, but we're going to do it together because this is the consequence, right?
yeah, and I also like here we're gonna go here into this next cycle because we're going to now talk about like the typical process. I'm going to preface it by saying that for anybody that has kids with specialized needs, majority of my experience toilet training individuals is with kids with specialized needs. So I 100% can tell you that everything I am saying can be replicated in many situations. Like, and I will stand behind that 110%. So the time frame that I'm talking about is might be a little bit longer, like depending on the needs of your child, but everything that I'm saying is 100% obtainable, right? Eh, so let's start from the beginning, right? And then we're
Yeah.
going to jump back into that idea of natural consequence. So the first thing that you're going to want to do, right? So potty training weekend, so you're going to want to do it in a weekend, right? So choose a weekend, block it off, Friday, Saturday, Sunday. Everyone get out your comfy clothes, get all those like oversized t-shirts from like every like giveaway, blood drive, whatever it is. Kid's going to be like rocking the side tie, roll up any loose rugs that you have. Get like it's toilet training time, buy sweatbands, whatever you got to do. Um, you're also going to want to make it like the bathroom should be like a super fun place. Like go to Party City and make it like everything that you would do for like a party room, like for your kid's birthday party. Like, hey, like hang up like stickers, balloons, like whatever. Like they should, like when they walk into the bathroom, like it should be like, we're going to the bathroom. This is so cool, right? Like that's the vibe they want to get. Because like if they feel like, oh, this is so annoying, or like, they go in and it's just like they're sitting there staring at the wall. Um, like it's not going to be a fun situation. Like you want this to be as positive as possible. We want to always be reverting to the positive. Um, Going into the next part with choosing reinforcement. So once your kid chooses reinforcement, that you need to cut that reinforcement out from any other part of the day or any other part of like your toilet training time frame, right? So let's say like M&Ms is what it's going to be. So you really shouldn't be giving them like chocolate or anything similar to M&Ms in other situations because it should be something that's selected and isolated just for the bathroom. So that way they associate like when I'm here and when I use the toilet, like this is what I get. Because the same thing, like okay, so fine, like if they can get it like after they successfully eat dinner, like then why are they going to do it for something that's like harder for them or might not be as enjoyable? Like you want to make it that like everything that they want that's like super fun like comes here. The same thing is, they're not going to come and sit on the toilet for just like a minute or two. You're going to want them to sit for a little bit longer. So like let's say they have a favorite book or a favorite iPad game or something like a show. You're going to want to make it that like that book, that iPad game, that show, they could only watch it when they're in the bathroom. Because if they can watch it when they're in the living room, right? Like first of all, you don't want them to be so necessarily zoned out on those like reinforcers in the living room that they won't be able to like break from play, right?
Mhm.
But if you have them that they're so focused when they're in the bathroom that they'll release their body, that they won't be as clenched, that they won't be as stressed, it's also going to be more likely to increase their urination, like, or bowel movements on the toilet. Okay.
What are some good treats or things that you've used?
Okay. So this was a picture that I took. Then I worked in a center and we were toilet training one of my clients. I'm going to preface this by saying that absolutely nothing in this picture is reinforcing to me, but that's why
Soy
it's so
milk.
important. Like, Dr. Digger, you were like, soy milk? Like, ew, why is there soy milk up there? And I was like, I don't know. Why are there raspberry jellies? Like, that's equal, like Twizzlers. Like, this is like the gross stuff is your Halloween bag, you know? But like, to me, this picture is like why it's so important to know like what's reinforcing for your kid, because like for this kid this was like the happiest thing on earth. Like for me it totally wouldn't work. Like I'd be in diapers forever if this was my reinforcers. But at the same time, like the reinforcers were there. This was in the bathroom. Like they got it immediately. Like that can like being able to give it to them as soon as they have it, so they make that immediate connection. That's so important. You want to give it whatever it is. You want it to be something that they can get in like small hits, right? You don't want to give them an ice cream that they like it's going to or a lollipop that's going to take them like an hour to eat. Like you want it to be that like they eat it, it's done, and then they're going to want to come back for more.
So not the sticker situation. Like you get 5 stickers, you get a treat, right? That
No, it needs to be immediate. It needs to be immediate, and it needs to be like it needs to be something that they want right away. I don't know any kid that's going to be so excited by a sticker that
yeah.
like that's going to keep them coming back for more. So that's again the juice, the candy, like even if that's something that you
Yeah.
swear off of any other day. And what was it that you were saying that you did for your daughter? That like the
Oh,
healthier
so
version of
my
candy?
very constipated 3-year-old, who I'm obviously treating her constipation, treating that aggressively before the toilet training. I was doing a combination of an M&M or a fiber gummy. I would max out on like 1 or 2 of those a day, and obviously you need to assess if that's a choking hazard for your child. But we were using fiber gummies, which I thought was very sneaky. So
Exactly. See, fiber gummies. They think they're getting a gummy. You're giving them fiber. Everybody wins. Toilet training miracle. Um, yeah. So that like you want to make sure that whatever it is that you're giving them, it can be consumed quickly. Just to go through the rest of them, hydration. You're going to want to up whatever it is that they're drinking, right? Because like something that we were talking about is that like my kids like drink all the time. Like they're constantly finishing water bottles, so they're constantly going to the bathroom. Like Dr. Danger's kids like don't
my
necessarily drink as
daughter
much.
held it 12 hours on the second day of
Yeah.
toilet.
So in that situation, right? Like it's going to be if you're going to the bathroom once a day,
Yeah.
like it's just you by giving them more liquid, right? Like so going into schedules, I have this equation in my head and I can type it out and like to share that when I wake up and when I start toilet training, I give them like an 8-ounce cup, like a regular little cup of like liquid to drink. And then once they finish that cup in a half hour, I take them to go to the bathroom, right? If they go to the bathroom, like, woohoo, yay, you went to the bathroom, wee, yay, great. Once they go back out, I give them another 8-ounce cup and then take them in a half hour later. If they
Mhm.
don't go to the bathroom, I give them another half a cup and then I take them in 15 minutes, right? So then that means within a matter of 45 minutes and they drink in 12 ounces, right? So if they have an accident at any point in between there, after the accident, I give them like approximately how much liquid it took them to have the accident and calculate
Yeah.
a little bit before. So that way I can catch them the next time right before they have to go to the bathroom, like sit them on a little bit longer, push on their stomach, like give them like the shivery chills, like to relax them, like give them those favorite videos, but all in the like all with the hopes of like increasing their like success of toilet training. Right. And then once they have like a few times where you're like giving them this increased hydration and sitting them on the toilet, you can start spacing apart more and more how much you give them, so it starts to look like normal things. But the other part of when you're giving them access to more liquids and more hydration is that like you also start to notice cues. right? So you'll start to see them fidget a little bit more. And so that way, when you see those cues, you can pick them up and zoom them into the bathroom and try and like catch them before they have the accident. So
Mhm.
again, you're able to set them up to be successful before they have the accident. And then lastly, accidents, right? Accidents are going to happen in life, in toilet training. It's important that it's, you don't let them see the frustration. It's not like, oh God, like the carpet, it's ruined, right? Like, cause we already remembered that this is all part of the process and we took it into account when we knew this was going to happen this weekend. And it's important that it's like, okay, like we're going to clean it up. Like, great. We're going to change our shirt. Like, going to put in the dirty laundry and we're going to go drink another cup. Okay. Remember next time, if you have to go to the bathroom, like just say like, Mom, you have to go to the bathroom, and like remind them of what the contingency is. Like, when you feel like you have to pee, you have to urinate, whatever words you're going to use, you know, go into the bathroom, tell mommy, daddy, whoever it is, like, and let's go. Okay. And then, Dr. Dinkner will go into this a little bit more with like, bowel movements and bowel movement training. Just for everyone to know, bowel movement training often happens. Bowel movement training, because bowel movements happen less frequently than urination. Like what parents will find is that there's usually like a time of day that like their child has a bowel movement that's like pretty consistent. Like it's usually either like once a day at the same time, every 3 days, whatever it is, like you'll start to notice a pattern once you start looking for the patterns in general with toilet training. So it's very often that like that bowel movement training might happen like a little bit after urine training, just because you have to like adjust to the other pattern. And then it's very common that nighttime toilet training takes longer for it to happen. Again, just like kid discrepancies. Like my oldest son was in pull-ups nighttime until he was 6.5. My youngest is 3, and he was night trained at the exact same time as during the day. Like he was a bizarre anomaly, right? So it happens at all different times. With nighttime toilet training, I'll say that I don't know why or how, but just trust me on this. When they wake up dry 3 consecutive nights, take the pull-up off. That's like the magic threshold. If they've 3 consecutive nights dry, like they're going to be good to go. Trust me, it works.
Also for pooping, I mean, it takes longer for a poop to come out than a pee accident, right? So the second you see your naked kid starting to push, it's pretty obvious that you need to have them go to the toilet. I mean, if you can direct them to the toilet and not be forceful with it, right? I mean, that's kind of an easier way to catch them. Whether or not they want to sit on it is a different story. And we'll talk about the medical issues later, and the act of wanting to hold in your poop because it's scary with it plopping into the toilet and whatnot, and kids getting into the holding pattern. I think you had one more slide before, Toby, if you had something else.
No, it was just so I just that this I think we can go into a little bit more in like questions and answers that like I think hopefully if people that are on here have had previous experiences with toilet training, hopefully we've given you a little bit of a different framework to approach toilet training, that maybe some of the patterns that I even some of the questions that I see are starting to come in the chat. Hopefully that you've seen things that are a little bit different than how they've been done before, and how introducing some of these methods might change the outcome of what's happened. So I think that going into this a little bit more in like question and answers would be the most advantageous. Okay, so we are on to medical issues.
Okay, so medical issues. I mean, so I would say most of not most of what I see, but a lot of what I see in the office is constipation or belly aches related to constipation. So for anyone in the pre-potty training period, I really reinforce that we have to get this under control before you even think about using the toilet, because once you're in the situation of having like a hard, even painful poop, that's when you're not going to want to go at all. And then it just kind of worsens the cycle, which we'll talk about. For kids who are already potty trained and are constipated, it makes it really unpleasant, or mid potty training dealing with constipation, and you're throwing laxatives at them and you're putting in suppositories and they're traumatized by suppositories in their butt, and then they have a negative association of using the bathroom. So whatever it is, if what you're doing is not working, please escalate to somebody. So if you're seeing your pediatrician, if you're not getting anywhere, then see a pediatric gastroenterologist. If you haven't seen anybody and you're managing it based on what you read on the internet, please start with your pediatrician. So you really should be treating aggressively with the hopes of having a nice, totally soft, painless bowel movement, like at least every day, at most every other day. If they're going a few times a day, fine. Obviously, if your kid has like chronic diarrhea, different story, might make it harder. There is something called toddler's diarrhea, which is common. But obviously that's something that you should talk about with your doctor. So we'll go to the next slide. So this is what I'm going to talk about. I'm going to call it the prime pooping position. So there are other countries in the world who have squatting toilets. So the hole in the ground is how you poop, and you're literally going to stand and squat your body over it. And that actually is more effective. So they've done studies that I won't be bringing up or referencing here, but there have been studies showing the time to poop is actually shorter in these squatting toilets than in the US and westernized sitting toilets. So the science to all of this is real. I mean, the squatty potty and using a step stool, this is what your kid needs to be pooping. So if you're having them, a little kid, sit on the potty and you're looking at this guy on the left in the red, your 2, 3, 4-year-old, their feet are not going to reach the ground, right? So that's why you either need a step stool. It doesn't matter what step stool, but something high enough that their knees are up a little bit, or one of the ladder potties that has the step where they can put their feet on. And often those have like the little handles to hold on to also. So what this is signaling is basically an opening of the anorectal angle. So you're getting this relaxation around the muscle, and it makes it just more physiologic to poop better. So like you may see your kids straining to poop. I mean, you'll see older kids like put their feet on the toilet seat, like in a ball, scrunched in a ball, because it's easier to get it out that way. Obviously, I don't want your kids to be pooping with their feet on the toilet seat, but this is how I want your kids to poop. Next slide. So if you're using the big potty, if you're using the big toilet, fine. Just make sure there's something for their feet, whether it's the climb up seat or the step stool. Toby has a great point about not transitioning from the little potties to the big toilet. I've done a combination of both with my daughter, and they both work. But if you're going to use a small potty, their feet are going to be on the ground anyway, so it may be a little bit easier for them to be pooping. So that's kind of the pooping position. So if your kid's feet are dangling and they're 7 years old, please get them a step stool. Okay, next slide. So this is talking about what we call the pain retention cycle. And for anyone who has seen their kid become constipated, they get scared to poop again. They're not, no offense, your kids are very smart, but they're not smart enough to realize if I just hold in my poop, like they think they can never poop again, which obviously isn't going to happen. So they're holding in this poop after this fear of the painful bowel movement. And the longer it sits in there, you're going to absorb the water out and back into the body, and the poop is going to be drier and harder. And then you're going to have this next yucky, painful bowel movement. And the kids who come to me either with like little balls of poop or like a giant softball poop, like once a week, these are the kids who I'm talking about, right? So you're not fully evacuating. So if you can get your kid to go every single day or every other day, with whatever it takes, we'll talk about a little bit with laxatives, but that's really what you need to do to avoid this pain retention cycle. Often diet is not sufficient. I see kids hold through as much fruit and vegetables and whatever else you're giving them, chia seeds. I mean, kids will hold through Miralax, kids will hold through X-Lax. Like, I've seen some really impressive holders. Toddlers are very strong-willed. So if you are still holding in the bowel movements, please take this to your doctor. So obviously all of this is compounded by like the classic toddler eating habits of like they're eating bread and crackers and cheese all day, which are all binding. There maybe some of them drink a lot of water, not all of them. Some kids love their milk, which is super constipating, and some of it's just a control issue and they just don't want to do it because you guys are talking about it all the time. So whatever it is, we will talk about briefly ways to just effectively make their stool soft, get them going regularly, and avoid this vicious cycle, which is horrible in the potty training era. For any kids for milk, I mean, first of all, I could talk for 3 hours about kids and milk and kids not needing cow's milk, but we'll move on. But if it is drinking cow's milk, let's say your child over 1 year of age, cap it at 16 to 18 ounces. Aside from the fact that there's a risk of iron deficiency anemia, it's really constipating. So if they're drinking 36 ounces of milk a day, which I do see kids who do this, cut down on the milk, water down the milk, and that's going to help them poop a little bit better. Okay, next slide. So this is the famous Bristol stool chart. So I will pull this up in my office when kids don't know how to describe their bowel movements or they think they're not looking at them. Obviously they're looking. What we want here is somewhere around a 4 or a 5. So these are explaining like the level of hardness. So type 1, little rabbit poops, your kid is constipated. 2 and 3, some people argue a 3 is normal. I would say your kid is constipated. Anything like a big solid mass is too constipated. Obviously, if your kid is having explosive type 7, I mean, we don't need it to be that loose. Type 6, we don't need it to be that mushy. But I would say somewhere 3 to 5 with the goal of somewhere around a 4, coming out super easy, nice and soft. It shouldn't be painful when it comes out. There should be no blood. They shouldn't be straining and crying when they're pushing out their poops because that just makes a negative potty experience. Next slide. So first, before even going into this scenario, I will just very briefly touch upon Miralax. And again, not wanting to give any like huge reward to any product here, but Miralax is the most commonly used stool softener / laxative that we have because it works the best and because it is the safest. So I have a lot of parents come to me, oh, it says we can only use it for 7 days, or I read that it can worsen behaviors, or it's not good for children who are autistic. None of that has been scientifically proven. None of that is evidence-based. It is not absorbed in any significant capacity. It's really just bringing water into the colon to make your stool soft. So I would rather a kid, if they need it, be on Miralax for whatever it is, a few weeks, a few months, to have soft, nice daily poops and get potty trained and not have the fear of pooping and get them, whatever it is, if they're regressing and holding again, and get it softer when they're starting preschool and then when they're starting, kindergarten, whatever the scenario is. I'd rather you use it than have hard stools. The dosing, I mean, you'll have to talk to your doctor or to me. But really, Miralax is the first, least side effect, most effective over any of the kind of diet probiotic benefiber scenarios. So that's what I'll just sort of preface by saying with the Miralax. So I'm going to give sort of a sample scenario of something that I see all the time. So there's a previously potty trained 4-year-old who's now having poop all the time, little chunks of poop or little soiling of poop in the underwear. The kid says she doesn't feel it. The parents start to argue because they're saying, you're always pooping in your pants. Why aren't you feeling it? What's wrong with you? Why aren't you getting up? And they think they're just being lazy. This is very common, and this is a medical issue. So if this is something happening to your kid, you need to see I mean, I would argue a pediatric gastroenterologist, and I'll explain why. Next slide. So this is describing something called encopresis, which is fecal soiling. There's a few scenarios of why this happens. I would say the most common is the kids who are holding their poops in on purpose. So what encopresis is basically a hard poop at the very bottom there, the rectum. And the kids hold it and hold it. I don't want to poop in school. I don't want to poop in the restaurant. They hold it and hold it and hold it for 3, 4, 5 days. And then the liquidy poops, or whatever you're giving them at that point, the stool softener, the Miralax, whatever it is, the prune juice, that orange stool is leaking around it. And you can get like full chunks of stool in the underwear. So this is pretty common. It usually means that there is a large poop sitting in there. Obviously, you need to see a doctor to see, is there a huge, massive stool in there? Is this going to be evacuated? But often when this is happening, it indicates to me that your kid needs to release this obstruction before we start giving them laxatives. Because these are the kids who, if you just keep giving them softener, 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 they're just going to leak all day. So that to me is a common issue with toilet training. There's another scenario of kids who are trying to poop and they just don't effectively get it out. So they haven't really learned how to relax the internal anal sphincter, which is hard to teach a kid because you should do it sort of subconsciously. And they're not fully evacuating, and that's why they're having these accidents. Obviously, there's very, very rare other causes of stool incontinence, whether it's like a neurologic or a spinal issue. I mean, these are like less common things that less common than what we're talking about here. But if this is happening to your child, if they were previously potty trained and now there's poop in their underwear frequently, that's the point at which you should be seeing a doctor. And certainly if it's not getting better with a pediatrician, a pediatric GI. So the dyssynergia is a little bit different. I mean, to teach them how to poop, usually this requires a bowel regimen, having their feet in, the nice potty training position. Sometimes we do have to escalate to pelvic floor physical therapy. There's a couple around here, not so many. And biofeedback, which is a little bit more invasive and certainly not super easy to find for kids. But this is just another reason why kids may have soiling. Next slide, please. So again, so for these kids who have leakage, please don't make them feel bad. If your kid is just busy and they don't want to get up because they're watching a movie and they poop their pants, okay, fine. Maybe I would say something at that point. But if this is consistent and they're not feeling it, I believe it, right? So this rectum is getting stretched with a big poop, which is why they're having these giant golf ball, not even golf ball, softball sized poops. And they're losing the sensation in the rectum. So that is reversible, but you need a really, really strong team. And you got to be really effective in your clean out and in the behaviors for this. So this needs to be managed truly aggressively, either before or with potty training. Okay, next slide. So this is something I saw online the other day. This is a different scenario for me than generally the encopresis kids. I don't even need to explain it to you, but like this is how I'm picturing the potty training kids. I mean, not quite maybe this dramatic with this delicious looking donut here, but the kid who is clearly wiggling and squirming and maybe a little poop coming out as they're running to the toilet. To me, that's more of a timing issue. I wouldn't argue that that needs necessarily medical intervention, but it's more just coming with age and maturity. And the kids who are having poop come out as they're entering the toilet, I mean, that's just a kind of a distracted related issue, but again, super common. So enuresis is the term that we use for urinary incontinence. Obviously super common to have some random pee accidents through age 6 years old, nighttime at least until 7, maybe more. But if your child was potty trained and they're having frequent pee accidents, this may mean that they are actually constipated. So most kids who are having this, like let's say 5 years old, previously potty trained, they get sent to a urologist. I would say all of the referrals that I see, clearly some bias here, but they come back saying the urologist told me I'm constipated and that's why my kid is having pee accidents. So they often go hand in hand. And this is something that we should be treating aggressively, together. And I would say before bed, limiting fluids, having them pee right before bed, alarms or the clock alarms during the day to go pee every 2 hours, whatever it takes to get them on a schedule. Okay, next slide. Incontinence at school. Super common, whether it's pee or poop. Kids don't like change. So the kids who had been in one school or daycare or home with a nanny and then are starting in a new environment are often the kids who are going to try to hold. So I'll hear about kids who will hold their pee for 6 hours while they're in a new school. Or the kids who will literally never poop while they're in school for 2 school years. If your kid is none the worse for it, fine. Obviously, it's not great to hold your pee that long. Poop, if you could get by, fine. But if you're running into trouble with this, it's super common. I would say ask the teachers first and ask the school nurse, what can you do? Because this is so common that they deal with this all the time, right? So whether it's a shared stall, someone else can hear it, someone else can smell it, the bathroom is scary, I don't like the stall and the lock, like whatever it is, they have a way to help. Sometimes even just going in after school hours and helping your child use that toilet so that they're used to it. So practice before or after school, with the teacher's permission. Sometimes these are ways to get around that. Next slide. So those are the major points. Really, I'll recap, Toby, and feel free to interrupt me. Assessing readiness, meeting the need to communicate before anything happens. So if you have a 15-month-old kid who is not telling you anything, they're not going to be ready. But communicating verbally or not verbally, getting your supplies ready. So find that reinforcement. That is not something that you're using every day. If they're watching Cocomelon every day, they're not going to care if that's the prize for pooping on the toilet. So you need some immediate reinforcement. And then, of course, the other supplies, pull-ups for only sleep time. You can call them the sleep underwear. Getting ready with like the t-shirt and the 3 days of being, right, either totally naked or in the shirt. And then making it just a really happy experience, even though it might be miserable for you. So it can be miserable for everyone else in the house, but just go along with it and make your kid feel really good about what they're doing. Toddlers love doing new things and feeling like they've accomplished something. So if you can make this a fun bathroom, a party for every time they go in the toilet, whatever it is, make them feel good about these changes. Toby, anything else you wanted to add before the Q&A?
No, I think you summed it up well.
Okay, so we have a lot of questions here. Let's see if we can try to go through these.
I think there are some that are a little bit more general.
Yes.
And I think that right now, the general ones make a little bit more sense just in the sake of time. And then I would say to be in touch with the ones that are like a little bit more child specific.
Okay, so we'll bang these out quickly. So recommendation, boys standing or sitting?
Honestly, like my kids naturally just went to do both sitting because it was also easier to just teach both, like sitting for like bowel movement and urine, and then then they didn't have to worry about like the aiming. And then once like my oldest went to school, just because my oldest is in school, my youngest is also a boy, like isn't in school yet. Like he naturally learned how to stand on his own. I really like do what works, but like nothing was anything like socially significant or damaging by teaching him to sit while doing for toilet training.
Yeah. Agree. I think sitting is easier to start.
In terms of of practicing putting a piece of toilet paper in the toilet and flushing it. The only thing that concerns me is that like the toilet also isn't a toy. So you don't want it to be like, that's going to be a really expensive plumber bill. Like if then, they start putting other things in the toilet and flushing it down, you
True.
know, like a little bit before, like great, they're not scared of it, but maybe not all the time. The toilet seats with the child seat attached, awesome. Two for the price of one, go for it. Copy of a recording will be available. Just like I'm going to answer part of a question that came in.
Okay.
If you have a child who the situation where the potty training started on the potty chair and now they're only requesting for the other potty, like when being put on the big potty, like there's an element of control there, right? And so like that's part of the reason why like I like to start with one, right? Because you're not going to be able to control the toilet in all situations. Like it's not always going to be able to be that way.
That's
So
actually so true. It's been a year and I still have the little potties around the house and the big potties. And it is so annoying when my 3-year-old's like, no, I want to go on the Elmo potty and not the regular toilet.
make the
And then
Elmo
you gotta go
potty,
upstairs.
make it disappear. That honestly, that's what I would say
Yeah.
because like,
It's just less work.
and again, there might be more specific information that's tied to it, but I would say general rule of thumb that like when it starts being tied to such like a specific thing like that, like you don't want there to end up being a power struggle, a control thing. Like that's why the toilet seat kind of eliminates all that. And
Yeah.
then just to be very, very clear, pull-ups, my recommendation is only that they should be used during sleeping times. They should not be used during wake times at all. So like
Agreed.
underwear, like during the like toilet training boot camp, they shouldn't during the day, like they should be as bare as possible, like no pull up, no underwear, and then start making the transition into um into underwear. Sorry.
No, I totally agree. I mean, the kids who refuse to poop in the toilet or like sometimes will pee in the toilet, I mean, they know that they can go in the pull up, right? Like that's why it's not fully done. That's why I think it doesn't work. So I think if you completely remove the pull up as an option, except at sleep, they're not going to want to pee or poop in their pants. Like you just have to do it. That's my feeling.
Yep.
So for anyone struggling with my kid knows, if your kid knows how to pee in the toilet, they don't need their pull up when they're awake. They just don't. They just don't want to do it. The reinforcement for trying, I would give verbal positive reinforcement, but not the treat. Like it's like we're toilet training like a puppy. Like I would give the treat just if they get it in the potty, but excited, great job trying.
Also, the reinforcement for trying is that when they're in there and they're sitting on the toilet for the extended period of time, that like they're getting the video, they're getting the attention, they're getting the special book. Like then the treat is like the above and beyond.
Somebody asked, what are your thoughts on the adult toilet seats with the child seat inside of it? Didn't know this existed until recently. My dad sent me a video of this. It's you can screw it onto your toilet and it has the kiddie seat in it. I think that's genius. Just make sure you have a footstool for them.
Yeah. I would, if potty training and they go back to daycare on a Monday or a Tuesday, like the diapers are gone after that. Like it's diapers do not come back. So
daycare knows what to do with them.
You need to make sure that that daycare is on board with, with the rest of the plan. Diapers are gone after that point. And then the last question, and then again, everyone can contact myself or Dr. Dankner with any further questions or any follow-up from this. Mm-hmm. But my question, somebody asked about holding in holding in when instead of using public restrooms, and any concern, honestly, like I think of like long-term concern. Like I know people that like as people in college that they would still have, like they went to a college that was local, like they still had to go home to like use the bathroom. And like if it's really a serious like aversion, right? This is now like going more in like the psychological category, and the behavioral category. Um, like I would just be concerned with like that, like adherence to routine, that need for sameness, like, you know, what is it about the public bathroom that is like so much of an aversion? And I would look
Yeah.
at it more from that. You know, Dr. Dankner, if you have any concerns about holding it for 6+ hours.
I'd
But
rather you not. I mean, poops you can hold all day, fine, but you right, there's a reason why your child is not peeing in this place. And for me it's finding the root of the issue. So if they think it's dirty, if there's no privacy, like whatever it is, try to identify the issue and work around it. There's one more question, Toby, that I think is interesting. If your kid has trouble doing new things because they don't want to do it because you're telling them to, which I think is really interesting because I think that speaks to like all toddlers. To me, you're not telling your kid to go pee or poop in the potty. Like it's just the only option, right? So they're kind of figuring out, at least how I view it, they're figuring out that it just doesn't feel good to pee all over their legs in the floor, and that's upsetting. So they should be choosing this sort of on their own. They shouldn't need as much of kind of that forced, sort of pushing from the parents. But you tell me.
so I'm going to go back to like that idea of the contingency,
Uh-huh.
right? Like it's kind of like when my kid says, like, you took my TV away, right? And I'm like, I didn't take your TV away. Like, you hit your brother. Like, the TV just went away after that. Like, sorry, you know? So it's like, I didn't take away your iPad. Like, you can get your iPad. You just have to go into the bathroom and sit on the toilet. Like, I just restructured how you're getting access to it. Right. So I'm not telling you what to do. That's why, like, really tapping into what that reinforcement is for them and really making it that they can only gain access to reinforcement in the toileting scenarios.
Mm-hmm.
You're not telling them what to do.
I'm trying to answer some of these additional questions just for the sake of time. I think this, I'll try to reach out to everyone who didn't get their questions answered. I think we got most of them.
Yes.
Yeah, I mean, if there's anything else, I mean, you can always reach out to Isabel through the Thrive team, and it can, get in contact with us. Obviously, I'm seeing patients in my office. I'm happy to see, your kids and tease through some of these issues. Toby does see patients, privately outside of Valley, so we can get you in touch with her as well.
Yep.
This has been really awesome and
Yes.
wonderful, and I'm so excited that we had you with us. Toby, thank you so much.
Yes.
Thanks
Thank
for
you.
having me.
Yes. Thank you both so much. And I hope everyone enjoyed this wonderful